And there are multiple causes to dry eye. It can be genetic, it can be hormonal, it can be age. The older we get, the drier we get. And it can be just partly of what one's diet is, how one's eating. We have found that a lot of the artificial sweeteners are extremely detrimental for good moist eyes. They tend to enhance dry eyes. But it can be very disconcerting because the tear layer on the eye is the first thing that bends the light as it goes into the eye. And if that's splotchy, it's just like the windshield during the rain. You're not going to get a good image, and you have to blink, blink, blink again to clear it up. So people that have dry eye, you might see them doing that, kind of blinking, trying to clear their vision up, because that tear layer has to stay smooth for good vision. Well, if it's dry, it's not going to stay smooth. It's going to break up and come apart. And things that seem to help with that are looking at your water intake. How many glasses of water are you having a day? Are you having 6 to 8 glasses a day, or are you having 1 or 2? And so that's where the water comes from, is from the water intake that you have. The other is including some oils in your diet. There's 3 parts of a tear layer. There's water, oil, and mucus. And if some of those are deficient or out of proportion, then one doesn't see well. The tear layer is not optimum. And so it has been found that some of the omega-3 fatty acids like flaxseed oil, you can get organic flaxseed oil. Barlean's brand is one of the best, and it's been tested as fresh and true by third-party sources. But you can get organic flaxseed oil capsules, which help many individuals, and in about 80% will find improvement in their dry eye by taking those daily. The other causes of dry eye can be where an eyelid doesn't stay closed at night. We call it exposure. And you've all seen individuals where they're sleeping, but yet their eyes are partly cracked open, and you're wondering if they're really sleeping or not. That tends to create a strip across the eye, and oftentimes it's where a person is trying to see out of their eye, causing it to be fuzzy and a little swollen and irregular. And things that can help with that are using lubrication at night, ointments. We prefer the preservative-free type of ointments for that. And also, one can use eye drops. And for some people, just using some eye drops and moisture drops, that may be helpful. For those that are real dry, they may help for 5 minutes, and then they're back to the condition that they've had. There's some other interventional things that can be done for dry that are really helpful, and that is there's 2 holes in each, one hole in each lid, 2 holes on each side, where the tears funnel off the eye into the nose and throat. And if the tear layer, tear glands aren't working well, so the faucet's dry, we plug the sink. So when one blinks and opens the eye, with that opening, it sucks the tears off the eye into the nose and throat. And through those 2 little holes where the tears normally are funneled to, if the eye is dry, the tear layer is dry, we plug them up, and purposefully. And there's little plugs, some temporary, some permanent, that can be put in to assist with that. And that will often, in about 90%, find significant improvement in not only their comfort but their vision as far as the dry eye condition goes. There's also, to help with the oil glands of the eyelids, there's a procedure called Lipiflow. And it's a little device that goes onto the eyelids and heats them up. There's about 20 oil glands vertically in each eyelid, and they secrete a little bit of oil into the tear layer, which helps keep it from evaporating. And the Lipiflow device goes onto the eyelids. The eye's been numbed up, and it heats them up, warms them up, and it massages them, kind of milks them, so it helps to try to get the oil glands working again. And that can be helpful for even up to a year in trying to enhance the comfort of the eye in a dry situation. And those are the main techniques that we use for treating dry eye.